This video will discuss the factor affecting growth. So what are the factors that affect growth? They are hormones, extrinsic factors, and the genetic factors. What's the difference between the short stature of different disorders? A delayed bone age with short stature suggests hormonal or systemic disorders. A normal bone age with short stature may be due to genetic cartilage dysplasia or growth plate disorders. So what are the hormones that affects growth? The hormones that affect growth are GH, IGF, thyroid hormones, androgens, glucocorticoid, and insulin and estrogen. So how GH affects growth? A deficiency of GH or deficiency of somatomedin or abnormalities of GH receptor cause growth hormone deficiency or retardation of growth. Hypothalamic lesion and suction of the pituitary stalk produces deficiency of GH. The clinical features of GH deficiency are short stature with micro penis, increased fat, high-pitched voice, and hypoglycemia due to unopposed insulin action. The bone age is delayed as in hormonal disorders in GH deficiency and GH receptor defects. The thyroid hormone effect on growth. Thyroid hormones are essential for normal growth and skeletal development, but they require GH for growth, and they also potentiates the effects of growth hormone on tissues. In hypothyroid children, bone growth is slow as in other hormonal disorders, and epiphyseal closure is also delayed. Cretinism or congenital hypothyroidism occur in 1 in 4,000 newborns. Newborn screening is mandatory for thyroid status because it is a preventable cause of mental retardation. Cretins are dwarf and mentally retarded. Thyroid gland plays an important role in cell differentiation during development, and a deficiency of thyroxine may cause cretinism and brain damage after birth. Thyroid dysgenesis is the most common cause and occur in 80 to 85% of cases. An inborn error of thyroxine synthesis occur in 10 to 15%, and TSH receptor antibodies are present in 5% of patients. Why cretins are dwarf? Thyroxine affects the ossification of cartilage, growth of the teeth, contour of the face, and proportions of the body. Cretins are therefore dwarf and have infantile features. So what are the clinical features of cretin child? Infants appear normal at birth, but they have difficulty in feeding with prolonged jaundice, hypotonia, large tongue, delayed bone maturation, and pot belly and umbilical hernia. So what's the difference in the height of the symphysis pubic, thyroid dwarf and pituitary dwarf compared to the normal child? The height of a symphysis of 8-year-old hypothyroid child is equal to 2-year-old normal child's symphysis pubis height, which is 15 centimeter. Number 2, the height of the symphysis of 8-year-old dwarf not due to thyroid is more than 8-year-old hypothyroid dwarf, but less than the height of a symphysis of 8-year-old normal child. The effect of androgens on growth. Growth is spurred at puberty in both boys and girls, is independent of GH, and is due to the anabolic action of androgens. This is due to the overactivity of the enzyme that catalyzes DHEA, dehydroepiandrosterone formation from zona reticulata of adrenal cortex. At puberty, excretion of 17 ketosteroid increased in both girls and boys. So what's the effect of androgen on growth? Androgen ultimately stop growth by fusing epiphyseal cartilage to the long bones. This is why pituitary dwarf, when treated with testosterone, grow fast but then stop growing because testosterone or androgens cause epiphyseal closure. That is why the patient with precocious puberty are also dwarf. So what's the effects of glucocorticoid, diabetes and estrogen on growth? Glucocorticoid, diabetes and estrogen decrease somatomedin activity. Adrenal-optimized animals have retarded growth, whereas excess glucocorticoid is a strong inhibitor of growth. Therefore, children taking steroids have slow growth as long as they are on these medications. So, what are the extrinsic causes affecting growth? Nutrition and food are most important causes affecting growth. Growth promoting factors require caloric energy, amino acid, vitamin, trace metals. Malnutrition impairs chondrocyte activity and it reduces insulin like growth factor and its binding protein levels. Injury and diseases stunt growth because they increase protein catabolism. And there is a catch up growth of about 400% that occur after a illness. Paracrine growth factors and cytokines also affect growth. Amongst the genetic causes, achondroplasia is spontaneous genetic mutation in the egg or sperm. The incidence of new point mutation in spermatogonia increases with paternal age. Condition may be sporadic or familial. So what's the cause of achondroplasia? It's due to the mutation in fibroblast growth factor receptor 3. The primary defect is abnormal chondrocyte proliferation at the growth plate that causes development of short, thick, long bones. Clinical features are short limbs with normal trunk with large head, saddle nose, and an exaggerated lumbar lordosis. Severe spinal deformity may lead to cord compression.